We are all familiar with the concept of a free market. You know the price, you make an informed choice. There's nothing secret about the price of gas or bread or milk.
Milk's fair, very fair.
In almost every case, you know what you'll pay before you buy.
What about medical expenses? Any idea what a hysterectomy costs?
No, but I'm sure it's outrageous.
Any idea what it costs to get a broken arm repaired?
Very expensive.
Any idea what the price of a hysterectomy costs?
Oh, no.
Any idea what the cost to fix a broken leg would be?
No, I really don't.
That's the problem with healthcare. According to doctors Keith Smith and Stephen Lantier, they launched Surgery Center of Oklahoma 15 years ago, founded on this simple principle: price honesty.
What we've discovered is that healthcare really doesn't cost that much, but what people are being charged for it is another matter altogether.
And so Surgery Center of Oklahoma started posting their prices online, all of them. Pick your surgery, see the price. They are all-inclusive, quotes, no $5 Band-Aids here, and they are guaranteed.
When we first started, we thought we were about half the price of the hospitals. And then we find out we're less than half price. And then we find out we're a sixth to an eighth of what their prices are. And we're just shaking our heads going, I can't believe the average person in the United States can afford health care at these prices.
Our goal really is to start a price war.
And it's working. Their first out-of-town patients came from Canada. Soon, everyday Americans caught on. 22-year-old Matthew Gang tore his patella tendon, dislocating his kneecap playing basketball. He's from California. We talked with his dad, Tom Gang, on Skype.
He had no insurance whatsoever. He also had a part-time job, so he didn't qualify for the state insurance plan, Medi-Cal here in California, or the county plan here that we live in.
Surgery in California was going to be about $30,000. Here, less than $6,000, one-fifth the price. So Tom and Matthew flew from California to Oklahoma.
It was well worth it. I need a rotator cuff surgery right now, and I'm thinking about flying out there and having them do my rotator cuff surgery because it was such a positive experience for us.
A handful of other Oklahoma medical facilities have started joining Surgery Center of Oklahoma in price transparency.
And here we've said, in a very radical and unique way, we've said, here is what we do, and here's how much it costs.
Critics are quick to point out Surgery Center of Oklahoma does not take Medicaid or Medicare. They do take private insurance, though. Hospital administrators accuse the Surgery Center of cherry-picking the healthiest and wealthiest patients, those who can pay.
Where we can reveal information that's meaningful to the patient, we very much support that. That's what hospitals need to do.
Craig Jones is the president of the Oklahoma Hospital Association, which supports transparency, in theory, though Jones calls the issue complicated and does not expect major metro hospitals to offer online price menus in the future.
The difficulty when you compare hospitals with surgery centers, for instance, is that surgery centers have, most of the work that they do are elective procedures, and they're a bit more predictable in the sense of what it is that they're going to do.
Still, the difference in price is staggering. We obtained these bills from major metro medical centers. A breast biopsy at Surgery Center of Oklahoma is $3,500. At Mercy Hospital, they charged $16,000. Gallbladder removal at Surgery Center, $5,800. At OU Medical Center, they billed $21,500. A hysterectomy at Surgery Center of Oklahoma, $8,000. At Integris Baptist, that same surgery is more than $37,000.
I think there's a tendency to oversimplify the issue of price comparison. But I think there's no doubt that hospitals are and need to be more accountable to the public to try to make the services and the businesses that they carry out more understandable.
According to the Hospital Association, about half of Oklahoma's hospitals are losing money. But prices these days may be dropping because of Surgery Center of Oklahoma, as patients are demanding price matching. Some hospitals relent.
Hospitals are having to match our pricing because patients are printing their pricing and holding that in one hand and holding a plane ticket to Oklahoma City in the other hand and asking that hospital to step up.
The economics are not as simple as a loaf of bread or a gallon of gasoline, but perhaps not too complicated for patients who are finding ways to save on medical care. Meyer, News Channel 4.